Good morning. Today I'd like to talk about contraindications to massage. So when we talk about contraindications, it means when not to massage a person. There's two types of contraindications. There's what we call a local contraindication, which means not to massage the area. So for example, if somebody has a broken bone, we don't massage around the broken bone. We can massage the rest of their body. Then there's what we call a complete contraindication, which means we don't massage the person at all. So certain conditions, for example, a high fever or certain other conditions may result in the decision not to massage the person. Okay, so we're going to cover various conditions that are contraindications. There's also what we call a caution. A caution means we have to be a bit careful or apply special techniques or procedures for that person. Okay. One of the most common contraindications is a local contraindication is varicose veins. So varicose veins are a deep blue vein, often appearing in the legs, around the ankles, into the feet, and they can be burst through deep massage on them. Okay. So they're a local contraindication. We don't massage over them. They're probably one of the most common things you will see. Spider veins are a caution. We have to be a bit more careful of them. They're more lighter. They're not quite as intense as varicose veins. So there is certain essential oils like lemon essential oil that can be used with oil massage gently over the area. But we have to be very careful, especially in intense varicose veins, that we could burst them. Another common contraindication is sprains, strains, bruises. We don't massage over a sprain, a sprained ankle, for example. We don't massage the ankle. There is techniques as the sprain alleviates. We could massage gently to increase blood supply. The same with a strained muscle. Whiplash is another one we don't massage. You can massage above and below an injury in particular, which will increase the blood supply to that area. We don't massage, as I mentioned, a fracture, a broken bone, but you can massage the rest of the person. It's a local contraindication. Bursitis is a common condition, which means the inflammation of the bursae, which is in between joints. We don't massage over that area. In general, any word ending in itis means inflammation, and we don't massage over an inflamed area. We don't massage an inflamed tissue or a joint. So basically anything ending in itis, we don't massage that area. It's just a local contraindication. Dermatitis means an inflammation of the skin. We're not going to massage over there. Hepatitis, an inflammation of the liver. We're not going to massage around there. Basically anything ending in itis. Osteoporosis, which is a degenerative bone disease, is a caution or a contraindication. So I would only massage the area that has osteoporosis with the doctor's permission. Otherwise, it's considered a contraindication. It's very easy to break people's bones, in fact, who have osteoporosis. Another condition is Osteomalacia, which is like childhood onset of osteoporosis. And another caution is a condition called Paget's disease, which is another bone condition, or rickets. All of these should only be done with a doctor's permission. When it comes to arthritis, we have osteoarthritis and rheumatoid arthritis. Both of these conditions can be benefited a lot by massage, but they shouldn't be done. Massage shouldn't be done when there's an acute phase of pain and swelling. So again, it is an itis, arthritis. Arthro means joint. So it's an inflammation of the joints. When it's in an acute stage, massage is not beneficial, but it's fantastic massage to prevent arthritis. And when it's not actually in an acute stage, massage can be very, very beneficial for arthritis of the different joints. So whether it be osteo or rheumatoid. If in any doubt or in an extreme case, get a doctor's permission. Another inflammatory condition is called ankylosing spondylitis, again affecting men in their teens to 30s often, where the bones, the vertebrae can become very fused together. Again, in the acute phases, we don't massage because it is an inflammation. But at other times, it can be very beneficial, again, to help get rid of that muscular tension that's causing or that's adding to some of the pain and perhaps adding to the condition itself. In terms of a lot of muscular conditions with overuse of muscles with sports, where it's strained, a muscle is strained, then we don't massage. If it's bruised, we don't massage. When somebody's having a cramp, we don't massage over the cramp itself. Tendinitis is another inflammatory condition that we don't massage when it's in an acutely inflamed state, but at other times, again, it can actually be very beneficial. The same with RSI, which is repetitive stress injury, one of the most common being carpal tunnel syndrome. Massage is actually quite beneficial because a lot of it is due to tightness in the muscles that have caused the area to become tight. But again, if it's acute, we would not massage. If it's acutely painful, or we would only get the doctor's permission. But usually if it's acutely painful, that would be a sign of not to massage. But then massaging above and below the area would be fantastic to get rid of that muscular tension that's causing the problem. Again, with certain conditions like frozen shoulder, or what they call housemaid's knee, or Achilles tendon injuries, we don't massage when there is an acute phase of that inflammation happening. We would wait and then massage when the inflammation's gone down, and again, above and below the injured area. So with a frozen shoulder, for example, the shoulder might be completely tight, but we would massage the hand, really loosen up the hand and the arm, and also loosen up from the leg and come up into the chest and in the back, and work all the areas that are leading up to that area being tight. Same with any area, whether it be the knee, we work the foot and the lower leg. So above and below an injured area if it's inflamed. When it comes to certain conditions like fibromyalgia or fibrositis, massage can be very beneficial for a lot of these conditions, chronic fatigue syndrome, all those kind of things. But we have to be careful because people's pain threshold can be quite low, so we would work within what they can handle. The same with muscular rheumatism, basically working within what the person can handle, not too much, but it will be beneficial. With muscular dystrophy and Myasthenia gravis, massage can be very beneficial, but again, it would be done in a more gentle way, working within the pain threshold of the client. Of course, we always work within the pain threshold of the client, but their pain threshold could be very low. And just provide circulation and get rid of the tension, get rid of the toxins. Same basic principle. For many conditions, it's actually the same basic principle. Work within the client's pain threshold, get rid of the tension, get rid of the toxins. The condition will improve, the state of health will improve, and the happiness of the person will improve. When it comes to disorders of the nervous system, we have to be careful of conditions such as meningitis. Meningitis can be actually spread, so it can be contagious, but it's also quite dangerous to massage people during an acute phase of meningitis. I would call that a contraindication, or only massage a person with a doctor's permission. If they've recovered, then it's perfectly fine to massage them. Another thing that we have to be quite careful of in many ways is somebody who's had a stroke. It's quite easy for a person to have a second stroke within a month after having the first stroke, so if we're massaging them, it could bring on a stroke, or they could just have a stroke and potentially blame the massage therapist. So I would be very careful massaging people who have had strokes, and make sure you've got the doctor's permission, especially during the first 6 months after they've had their first stroke. Yeah, I would generally get a doctor's permission to massage people that have had strokes, just to be safe. The same would be said of a TIA, or transient ischaemic, I can't even pronounce the word, ischaemic attack. It's called a TIA. It's like a mini stroke, but that would basically be something that I would only work on a person who's got a doctor's permission that it's safe to do so, because there can be a risk of a reoccurrence of that. Epilepsy is just a caution, in my opinion. It's best to massage people on a futon on the floor, because if they did have an epileptic fit while you're massaging them, they could hurt themselves falling off the table. but it's actually shown that massage is quite beneficial for epileptics. But if a person has a large number of epileptic attacks, be careful about pushing a lot of energy to their head, perhaps. Make sure you've massaged their head and then calm their mind. And you may want the doctor's permission if they are quite severe, the epileptic fits. Certain skin conditions are contraindicated. Any skin condition that's contagious we have to be very careful of, obviously, as a massage therapist. Shingles or different just red inflamed skin conditions can be aggravated by massage. I would get a diagnosis if somebody has a skin condition, either from the person, if they've sought a medical diagnosis, or from a doctor, that it's safe to massage before you massage people, or avoid that area as a local contraindication. Many skin diseases can be, like eczema, can be brought on by stress, even psoriasis, but you wouldn't massage over the area. Just a general massage, avoiding those particular areas would be good. With elderly people, we have to be careful. Their skin can become very thin. We don't want to break the skin, so we would massage very gently over thinner skin as well. And as I mentioned before, we're not going to massage over bruises or varicose veins. Some skin conditions are total contraindications because of the risk of infecting the massage therapist: impetigo, scabies, ringworm. Those are 3 examples where you would generally wait until the infection is completely cleared up because you don't want to catch those yourself. Certain skin conditions like acne can be a local contraindication where we're not wanting to get oil in there and open the area up. But a lot of things like age spots or discoloration of the skin where the melatonin's gone out, that's not a problem. You can massage over there. Even psoriasis, it's not, as long as they're not broken or open, then it's not that big a deal. The same with eczema, but I would still generally tend to avoid those areas. If in doubt, avoid it. Certain skin conditions like herpes or cold sores, that would be a local contraindication. We're not going to massage over the cold sore. Athlete's foot, so tinea, often occurring between the toes, especially the little toe and the second one. The skin will become very thin, and you would break the skin very easily, so that is a local contraindication as well. Things like boils, carbuncles, warts, they're all local contraindications, so you're not going to massage over those areas. Things like head lice we have to be careful of for people with hair. You could easily catch the head lice, so you would probably make it a total contraindication until that infection is cleared up. Things like the common cold and flu, sinusitis, laryngitis, they are all contraindications or total contraindications. Sometimes it can actually spread the cold or flu throughout the body, so a person can feel worse. Sometimes in long-standing colds or flu, massage can help boost the immune system to push the cold or flu out. But I wouldn't be doing excavation on people that aren't used to it if they've got a cold or flu. It's, like I say, it can make the cold or flu worse. And the other thing is that they can be contagious, so that you can catch them. So if you really had to, for some reason, massage somebody with a respiratory problem that's contagious, then use a face mask. That would be particularly the case with people even with tuberculosis and things. I would recommend using a medical face mask in order to massage. It's not a contraindication for the person who has tuberculosis to receive massage, especially if they've been on medication for at least a month. I would get the doctor's permission, but you just want to be careful that you don't catch it. The only form of tuberculosis that is contagious is what's called pulmonary tuberculosis, which can be then spread in water. When a person coughs or breathes out, the water molecules can have the tuberculosis virus on there. That's where you'd want to use a face mask. Other forms of TB are not actually contagious, so it's pulmonary tuberculosis that you're wanting to be particularly careful of. Massage can be quite beneficial for people who have sinusitis, where their sinuses are more inflamed. Again, you'd go very gently over the area that is inflamed, even though we talk about, inflammation being a contraindication. In that case, just very gently around the sinuses, and then deeper head massage can be very beneficial. For people with asthma, asthma is a caution. Okay, massage is very good for people who suffer from asthma, but not during an asthmatic attack, obviously. And sometimes massage can bring on a bit of a asthmatic wheeze for people. So people with asthma, it's good to have their medication handy that they'll need. But stress is a large precursor for people to get asthmatic attacks. So massage is going to reduce stress. It's going to help them getting in to the belly. The abdominal area is very beneficial for people who suffer from asthma. And just reducing the amount of overall body tension. A lot of people do get asthma when they're children due to emotional stresses and things, and those emotional stresses can come out when you're actually massaging them as well. For conditions like pleurisy and emphysema, I would recommend a gentle massage under medical supervision. With conditions like angina, massage can be very beneficial because, again, stress and anxiety can bring on angina, so getting a regular massage can help with that. But with heart attacks, I would recommend that after a person's had a heart attack, you wait 2 or 3 months before you massage them, mostly from the point of view of a person can have a reoccurrence. A massage could stimulate that in some way. I would recommend then getting a doctor's note to say that it's safe to massage the person who's had the heart attack, mostly for the practitioner's protection. With high blood pressure, we do have to be a little bit careful that we don't want to put pressure on the heart, causing a heart attack. So I would start off at light to medium pressure with the person, of course working with the person, getting rid of their tension, because a lot of high blood pressure can be caused by muscular tension. As the muscles become tight, it puts the pressure on the blood vessels, so getting rid of that tension will help. But some high blood pressure is caused by obviously cholesterol and different things where the arteries are clogged up. And in that case, if we do very vigorous and deep massage, we could then put a lot of pressure on the arteries and leading to the heart. So gentle to medium pressure for people with high blood pressure until you gradually reduce that. If you can reduce the blood pressure with massage, in which case then you can start to go more deep. With low blood pressure, we have to be careful of the person feeling lightheaded at the end of a massage, and especially getting off the massage table. They could feel quite spaced out, feel quite dizzy, that sort of thing. So allow them plenty of time to rest, and then sometimes you may help them get off the table if they are feeling in any way lightheaded or dizzy. But I'd recommend they just rest there until they don't feel that lightheadedness. Same with things like arteriosclerosis, which is a sort of thickening of the blood vessels. I would give the massage with a doctor's permission because of the risk that could affect the heart and the blood supply. When it comes to things like deep vein thrombosis, that's quite a controversial area, and I would avoid working on people with DVT unless you really got the doctor's permission and it was completely safe, but it's generally a complete contraindication to massage. It's generally contraindicated for at least 3 to 6 months after the diagnosis, and then only with the doctor's permission. When it comes to disorders of the digestive system, we have things like nausea, which is a caution. If you're going to massage deeply and it's going to cause vomiting, well then it would be a contraindication. If it's quite severe and they're likely to vomit, you would generally not massage them. It's going to make a mess. Of course, in some forms of therapy that can be beneficial, vomiting, like in Panchakarma and Ayurveda, they use therapeutic vomiting or to get rid of poisons. But it's not the sort of thing you want necessarily happening in your clinic. With a lot of other conditions of the digestive system, gentle massage can be quite good for Crohn's disease and for different minor inflammations of the duodenum and the small and large intestines, things like diverticulosis, colitis. So with blood disorders, we've got things like severe hemophilia. That's totally contraindicated for massage. Whereas other milder forms you could do with the doctor's advice. The same with anemia, sickle cell anemia or anemia. I would massage the person only with the doctor's permission. So yeah, with anemia, it's more when it's severe. Mild anemia we don't need to worry about, massage is fine for. But it's more the severe forms of anemia that we're wanting the doctor's permission. When it comes to things like cancer of the blood, leukemia, for example, I would only do that with the doctor's permission as well. Any form of cancer I would only massage actually with the doctor's permission. Massage has been shown to be quite beneficial actually over the years for people with cancer, but we don't massage the tumor itself. I would work with the medical practitioner, make sure that there's no areas that you shouldn't massage or certain techniques that you shouldn't do. Get the doctor to say whether it's light, medium, or heavy pressure that's appropriate. But any form of cancer, I would do that for. There's been a lot of evidence to say that massage is beneficial in preventing cancer, as well as helping for relieving pain for people with cancer, and just generally increasing the body's ability to respond to that cancer. But work with the doctor, don't work over the tumor itself. Generally, we don't work when a person's having chemotherapy. It can make the body quite weak. We have to be very careful. Again, only with the doctor's permission, but in general, if they're undergoing chemotherapy, it's best to wait till that chemotherapy session is finished before you start massaging. For conditions like AIDS, massage can be beneficial. Again, we just have to be more careful with our hygiene. We don't massage over where they've had an injection. And if they're very weak at the time, we have to, again, seek that medical advice before we massage, or just very gentle. Yeah, making sure AIDS can only be spread generally from blood to blood contact. So if we have an open wound and they have an open wound, that's how it can be spread. Same with hepatitis B that we have to be very careful of. But other than that, there's no contraindications specific for it. When it comes to things like hernias, they're locally contraindicated, so we wouldn't massage over an abdominal hernia. Cirrhosis of the liver is locally contraindicated, so we wouldn't massage over the liver itself. Hepatitis is a local contraindication, so we're not going to massage the liver when they've got an acute stage of hepatitis. Gallstones, kidney stones, massage can be beneficial, or at least not contraindicated as long as the person's not in pain. Kidney stones actually can be benefited even when a person's got a kidney stone moving. I personally have had that and have found that massage was beneficial to help with the pain of the kidney stone and to actually help it move. With pregnancy, massage is contraindicated, especially in the first 3 months on the abdomen, on any pressure, and then light pressure only throughout the pregnancy can be nice, very light. But you don't want to be massaging the abdomen in any deep way during pregnancy. In Chinese medicine, they have certain contraindication points like here and here, up here, and around the ankles, and which are also reflexology points. There's some evidence to prove that they're right, some studies have shown that they don't bring on miscarriages, but at the moment I'm still cautious of using those points during pregnancy. So again, right in between the finger and thumb in particular, which can be used during labor, however. The same with the points in the ankles, they can be used during labor to bring on the birthing process. During menstruation, massage can help with abdominal cramps. It's not a contraindication. However, the patient may not want to be massaged in their belly during the time they're menstruating. That is a particular individual choice, something that could be discussed with the person. For endometriosis and pelvic inflammatory disease, deep abdominal massage is contraindicated. For prolapsed uterus or vagina, again, deep abdominal massage is contraindicated. Other contraindications we need to be careful of are after recent surgery. So after recent surgery, we would generally wait 3 months, but it depends on the nature of the surgery. So I would get the doctor's permission. because there could be minor surgery, which might be just a local contraindication, or major surgery, brain surgery, or abdominal surgery, or heart surgery, that may be a total contraindication for a period of time. So get the doctor's permission and ask for light, medium, or deep pressure, if it's okay, before working on people with surgery. Again, with certain medications that people are on, they may increase bruising or move blood clots easier. Again, if in any doubt, get the doctor's permission to massage a person on certain forms of medication, even things like warfarin and things like that. I generally would be careful about massaging people if they've had alcohol or significant amount of alcohol in their system. It can very much affect the way they drive, so the combination of alcohol and massage can make people very out of it. It can increase all the negative effects of alcohol, so vomiting, nausea, just dizziness, that sort of thing. Again, even with certain non-prescription drugs as well, I would be careful about massaging people. Of course, massage can be very beneficial for people that are wanting to give up drugs, because a lot of the massage can help deal with some of the underlying emotional issues, can make a person more relaxed. I've seen a lot of people get massage and give up smoking because they feel more relaxed, less stressed out. In fact, it's a lot better thing to invest your money in than smoking or drugs or alcohol. So that concludes our contraindications section. There are other contraindications, but those are the major ones. We don't manipulate or hyperextend the neck of a person with Down syndrome. That's another one. But in general, that's the major areas that you're likely to see. But if ever you're in any doubt, always get a doctor's permission. If somebody's got a condition that you're not sure of, or something else that you're anyway not sure of, just get the doctor's permission and ask them for the light, medium, or deep pressure. You would then keep that with your case history form in your filing system, that doctor's note. Okay. Thank you very much. Look forward to the next lesson.